Good day everyone, I am Danee Cordero, a student midwife from Occidental Mindoro State College. For today's video, I am going to show you how to perform vaginal examination or internal examination during labor. So vaginal examination is the shortest way to know if the labor is progressing normally. This video will show you the steps in doing this exam and the key information to gather. Before I start, I just want you to know the purposes of vaginal examination or internal examination. So, vaginal examination is important to know what is the state of your labor and to know if the bag of water is ruptured and if your baby is engaged and ready to be delivered. Before proceeding to the video, I just want you to know that vaginal examination can increase the infection. So do it initially and not more often than every 4 hours unless necessary. Always remember that never do an internal examination if there is bleeding from the vagina. This could be a sign of placenta previa. You should then transfer the woman to the hospital that can do cesarean deliveries if the vaginal bleeding occurs. It is important that this exam be done with sensitivity and gentleness. Explain to the patient how it will be done and ask for her consent. You can ask her to empty her bladder first before doing the examination. To begin, prepare the equipments. Wash your hands and use gloves. Ask the woman to bend her knees and open her legs. Do not force her to open. Be patient and talk to her if she is afraid. Hello po, ako po si Danee Cordero, isa po akong student midwife from OMSC at ngayon po ako po ang mag-IE po sa inyo. So, pwede ko po ba kayong i-IE, mami? Para po malaman ko kung ilang centimeter na po ang na-dilated ang inyong cervix at para po malaman ko kung gaano na po ito kanipis. Opo. Yes po, thank you po. So, pwede po ba natin itaas ang ating dalawang binti? Thank you po. Sige po, mami. If a woman hasn't already washed her genital area, gently wipe from front to back. You can use pick-up forceps or your hand to hold the cotton balls and wipe the genital area. Before checking the woman internally, you should put on a lubricant oil to your finger and wait until she finishes her contractions. Then suggest to take deep, slow breath to relax. This will reduce the discomfort of exam. So first, separate the labia and gently insert your index and middle
mami,
finger.
Papasok ko na po. Hinga
Observe
po
if there are
malalim.
any conditions such as infection or scars from genital cutting that could affect the delivery. Even before labor begins, the cervix may start to change. It can soften, thin, and dilate a little, especially with a mother who already have babies. If your finger is already inserted at the vagina of the patient, you can check the pulsation of the cervix. Early in labor, the cervix may be positioned towards the back of the vagina. As labor progresses, the cervix will toward the front and it's easy to reach. Feel the consistency of the cervix. Is it firm like your nose or soft? As labor progresses, it will become very soft. Next, check thickness of effacement of the cervix. In early labor, it may be thick. It will be shortened as the cervix effaces, eventually becoming a thin band around your fingers. Now the cervix is fully effaced. Next, check the dilation. You will learn with the practice how many centimeter the cervix is dilated by how far apart your fingers are as you gently stretch the cervix opening. The cervix is always determined in a cervical opening next to the baby's head. At the beginning, the cervix forfeit a fingertip. 1 centimeter fit 1 finger tight. 2 centimeter fit 1 finger loosely. 3 centimeter fit 2 finger tightly. 4 centimeters is 2 loose fingers. 5 centimeter is a little open than 2 loose fingers. The fingers touch the open further at 6, 7, 8, and 9 centimeter. At 10 centimeter, the cervix is completely open, fully dilated. You are not able to feel any cervix in front of the baby's head. Slip your fingers around the head to be sure you feel that no cervix at all. At 10 centimeter with no cervix in the way, the woman can now safely push the babies out without risking a tear of the cervix. Check what part of the baby is coming first. You will usually feel a hard, smooth head, but sometimes you can feel the soft buttocks of the baby. Check how close the baby is. Is the head high, unable to be easily touched by your fingers? Is it midway, there are at the end of the fingers, or low, coming into the vagina? Check if you feel the bag of water, they will feel like a fluid that divulges in the cervical opening. The membrane usually breaks late in labor, but can be break anytime even before labor begins. Notice the color of the water. It is clear or light yellow. And the baby's heart rate, if normal, the baby is probably okay. Green water means that there is meconium. The baby's feces is in the water. It's normal to have a little blood mixed in mucus after the vaginal exam. Check for a foul odor that could indicate infection that should be treated immediately. This woman's cervix is 6 centimeter dilated and fully effaced. The head of the baby is easily touched by your fingers, and the bag of water is intact. Encourage her to walk to help her labor progress. We are now done at our vaginal examination. So always remember to do the vaginal examination with sensitivity and gentleness. To find out the position of the cervix, whether it is firm or soft. To observe the position and presenting part of the baby. To assess if the mother is ready to deliver her baby. So that's all for today. I hope that you learn how to do vaginal examination or internal examination and what is the purpose of it and what is the key information to gather during internal examination. Thank you.